We're still waiting on the official data that they have submitted to the FDA, but from what has been released to the media, we anticipate that this is an oral medication that people could take at home when prescribed that would enable them to treat a COVID infection and hopefully prevent hospitalizations. Supposedly an oral medication that you would take twice a day for 5 days. So not unlike something like Tamiflu, it's a pill that you could take at home. We think, at least from what we've seen in the early releases to the media, that it interferes with replication. So it doesn't work to prevent COVID infection, but it would work to prevent the replication of the virus in your body. So less likely for you to get really ill or progress to very severe symptoms. We don't know yet. That will determine or be determined once the FDA makes a decision around an emergency use authorization for the medication. Merck has indicated they feel it's most appropriate perhaps for those at high risk of severe disease from COVID. So it may be limited to populations of a certain age group, perhaps older patients or those with underlying medical conditions. So we'll have to see what the official recommendations are, but that's certainly a category that we would anticipate. Well, from I think an overall standpoint, it's another tool in our toolbox to fight COVID. We have vaccinations, which are probably the best way to bring down the epidemic, the pandemic, reduce the course of illness, prevent infections. We have, in some cases, therapies that are used for individuals or patients that are admitted to hospitals. But for the most part, we don't yet have readily available and easy to use therapy for people who aren't in the hospital, and that is not a preventative like a vaccine. And molnupiravir is a medication that would fit that category so that we could offer it to individuals, particularly in the outset of therapies that are more difficult for patients to access. Right now, the only thing that really fits that category is monoclonal antibodies, and that requires IV infusion over a certain period of time and might require a location that's harder to get to, and certainly requires physician's orders for that therapy. And so it's easier available, something you take at home, and still would hopefully be something to prevent severe disease. We know that there are many other companies working on similar anti-COVID therapies. I think Roche and Pfizer also have medications in the pipeline. And each one of those can be very helpful because, again, we don't know the supply of this medication, even once it is authorized and recommended. We don't know how much will be available at what time. The more we have in terms of options, the better I think it is for us to be able to fight COVID in many different ways. So we know that COVID infection, COVID disease can affect the body in many different ways. And there are a lot of studies now ongoing to look at the effects of what they call long COVID, which is what happens to your body after even you've resolved the infection. Those can affect adversely your mood, and they could promote long-term fatigue. We've seen the effects of blood clots from COVID, which often affects some of the small blood vessels in your body. And often because of that and the inflammation that occurs in your body when you fight the infection, you can see organ damage. And we've seen organ damage in various places, to include the brain, the lungs, the liver, the kidneys, and in some cases, the pancreas. And the pancreas actually has the ability to help regulate our glucose levels in our body. And so when that's disrupted, that can lead to either an exacerbation of diabetes or actually can cause diabetes in patients who hadn't had it previously. Well, anything that would increase the prevalence of diabetes is of concern, and we certainly have challenges here in San Antonio, Merck County with a high prevalence of diabetes. And so if we have additional contributions to that from COVID infections, that certainly would exacerbate the burden on our own healthcare system and individuals who might be infected with COVID. I think diabetes is a chronic illness, and successful management, it requires, I think, routine care between a patient and their primary care provider. And we know that that has been disrupted because of COVID. We know that people have delayed going to the physician for routine maintenance, for preventive care, for immunizations. That's certainly affected even more disproportionately pediatrics. And so we know children that have fallen behind in their immunizations. So it would certainly make sense that diabetics, who often would benefit from more regular visits to their physician and better monitoring of their therapy, could also be adversely affected by the disruptions that COVID has caused.